And I guess I now will introduce Dr. Ferris, who will give the closing remarks.
Thank you. Does this work? So I wanted to take the opportunity to review and highlight some of the things you've heard today and add some detail, in particular around our strategic vision and where we've come in the past 3 years, particularly around an organized using the 6 essential characteristics. We want to express our gratitude for support and institutional research space that has been expanded, in particular to drive the strategic vision around cancer immunotherapy and new wet and dry lab space, which is the first new research space, a major increase since we moved into the Hillman building. And then right out the back, the new plans going on for the Hillman Specialty Cancer Hospital, a major increase in our research and ability to treat our patients. Organizational capabilities are evidenced by a new and unified cancer center led by a strong and cohesive senior leadership team and newly defined leadership responsibilities that has helped our vision setting and strategic planning. This new leadership has helped to channel and guide investments, particularly around community outreach, screening, and interventions, and in key ways to leverage our efforts for identifying and eliminating cancer disparities. We also have a new focus with a new associate director who has harnessed almost $1.5 million in cancer center funding to drive high-quality education and training initiatives. Our new leadership focus helps us to build on basic translational and clinical research capabilities. You've seen how this leadership-driven reorganization of programs has led to enhancements in our clinical research enrollments and new shared resource capabilities in particular areas of transformative science, such as immunology, immunotherapy, genomics, and precision oncology, and as was brought up earlier, this transformative and transdisciplinary data science, which will be the topic of a retreat that we have planned for May of this year, which we think will permeate through the Cancer Center and our strategic vision. Our cancer focus is evidenced by overall funding as well as $30.3 million from the NCI, major investments in cancer-focused recruitments and new faculty, high-impact publications, almost 15% over impact factor of 10, and we believe the trajectory of our current increase in interventional and therapeutic accruals over the past 12 to 18 months will continue with selected focus on the network and trials appropriate for those sites, as well as novel investigator-initiated trials at the main academic site. The increased institutional commitments from Pitt and UPMC are being put to work in this new research space, as well as the philanthropic funds and endowed chairs that will help us to continue our vigorous recruiting, which has occurred over the past 2 to 3 years, and over the next 5 years. We believe that will continue both in the clinical investigator and to populate the new research space, particularly in cellular immunotherapies and our new CGMP capabilities. The new expanded authorities of the director help us to drive our research into our service line and catchment area. And we've been working over the past 6 months for a new incentive process for our clinical research to recognize the time it takes to enroll. And this is one example of how new expanded authorities given to the director enable us to drive investments into the community and help offset some of the time for clinical research. The vision for this center, as I've shown you in the 6 key areas, is being advanced in specific ways over the next 5 years in the coming CCSG renewal. We want to include to achieve increased HPV vaccination. We want to reduce smoking prevalence. We want to expand and renew our T32s and increase K-grant successes, including institutional funding for a pathway to faculty appointment, essentially an internally funded K transition to independence. We've invested a great deal in recruiting new teams and investing in pilot funding for these teams for 5 spores, both renewals and new submissions. And our clinical research organization is enhancing clinical trials to where we believe our target can be a 50% increase in both therapeutic and overall interventional accruals. This has been facilitated by community champions, the iPhone app, the incentive time offset, and particular clinical trials that are appropriate for our network, as I mentioned, where many of the patients are seen. I mentioned data science is key, and we have a universal consent launched about a year ago, harnessing our expanded cancer genome facility and the increased bioinformatics capabilities. Translational cancer immunotherapy is evidenced by a reorganized early phase immunotherapy. You heard about the Lemieux gift, which has been matched by UPMC, as well as commercialization, channeling the UPMC funds through the Immune Transplant and Therapy Center for Entrepreneurship. And the aged population, extending across the continuum of life, and collaborating with Pediatric Oncology and the Aging Institute, and harnessing leadership through Dr. McAllister Lucas, as well as our investigators in the large Hillman Cancer Center network and our electronic medical record. Thank you very much for taking the time, for all of your input, and I'd be happy to answer any final questions.
Bob, no questions, just a suggestion, an EAB suggestion. In your vision for improving vaccination, you've also talked about screening, both for breast and lung cancer. I think I would include those and emphasize your vision for controlling cancer in Western Pennsylvania, which is a huge opportunity. I guess, and I really like, this is much more of a summary than you usually see at the end of the day, but I really like this. And I think it would be also helpful to, if there are 2 or 3 places where there are really novel homegrown ideas that will come to fruition in the next 5 years, you could mention those as well.
Great, thank you.
I had a similar reaction. I'm interested in the views of the other members of the panel, but I would have liked to have heard some of that vision up front.
Yeah,
A shorter presentation at the end and front load that, some enthusiasm for your vision of the future and how it's actually going to play out. You know, you're going to get these spores. You're going to make a big impact on the community. You articulate it here. It's at the end of a long day, and I think it would, getting some of that that spirit into the front end would get the site visit off to a really strong
Well,
start.
and you could present it at the front just with those topics. You know, we're going to control cancer in our catchment area. We're going to further our treatment of lung cancer with novel approaches, and then fill in, and then summarize some of the things you've heard during the day at the very end.
Great, we can do that for sure. Thank you.
So can I ask I just noticed this in your final things. What is your rate of HPV vaccination in your catchment area right now?
About 70%, high
Really?
60s.
So that's higher than any state in the country.
Yeah, Allegheny County.
Because that's very high.
Did I quote the right number, Lynn?
Is that for 1 dose or 2 doses?
I think that's
3 doses? Wow. Is that right? That would be higher than any place in the country. Yeah, but that would still be higher than any place in the country. Is that really true?
I think it's a minimum of 2 doses.
3-dose completion by
I think minimum of 2 doses.
The highest thing you say. Nobody has that. Like in Rwanda, where they don't ask you whether you want if they get around. I would check that.
Okay.
Or say it a lot. I only say that because you said you want 90%.
Yes.
Nobody has that in the country. So if you really think you can get to 90%, you should really make that. That's a big thing. Nobody is even close to
I
that.
think the number went from low 50s to high 60s, close to 70, so.
I just think you should highlight that, because
Okay.
if you really thought you could get to 90%, that would be an unbelievable achievement for any place in the country.
We did have an
Be
effort.
sure it's true, and then make sure you emphasize that.
We did have an effort organized through the Allegheny County Medical Society, and that kind of policy is where that will happen.
Okay, all right.
Yeah, actually, is it Bob or? Okay. So a couple things. I completely agree with putting the division up front, and I really look for the passion and importance at the end about why the work here is so important and what the impact is. And I agree with Tim, because picking out some of those future directions, it may not need to be so many, but it could be very high impact sorts of things. Because some of those, like 90%, when I had the same reaction, because I just wondered if that were actually achievable, or 5 spores, is that really the goal here? It seems like there's something that's really big and important talking about why Hillman is such an important cancer center.
Okay.
And number of lives, the impact, stuff like that.
Was that a question? I'm sorry, because
Yeah, having those sorts of things, like what is the magnitude of the impact of the center? That's the thing that we didn't really always get that across the course of the day. Number of lives impacted, stuff like that.
okay, so we could add some in that regard. Okay.
All right, so we'll just need a few minutes to talk among ourselves, and then Bob, maybe you and Ed can come back, and Chad, and we'll discuss some of our thoughts about the day.